Hearing loss in children is not uncommon, and unfortunately it's a hidden disability. Probably 1 in every 100 child might have some form of hearing loss due to infections, medication and other reasons. What we are more concerned about is permanent hearing loss, and probably 5 to 6 out of every 1,000 children have significant permanent hearing loss. What should we be looking out for? Does a little baby not startle to loud sound? A little older baby may not turn towards the direction of sound or name call. The child might ask you to repeat what is being said. Probably the volume of the television is up loud. And in the older child, you may notice poor clarity or poor development of speech and language. These are all the things you need to look out for and probably suspect that your child might have a significant hearing impairment.
So babies start hearing before birth, when they are in womb actually. So it's very important for us to pick up hearing loss as soon as possible. Hearing can be assessed and picked up as early as 1 month of their life and completely diagnosed by 3 months of their life. It's important to pick up early because there's a critical period for speech and language development. They lose out those important years when the nerves are developing and neural network is developing in the brain. There's a time for auditory development. If it is not picked up and intervened on time and they do not get treatment on time, they miss out those critical period. There are serious consequences because if we do not pick the hearing loss early in their life, they can have serious consequences like significant speech and language development that will lead to social isolation, communication skills, poor communication skills, and that will further lead to poor scholastic development and academic performance, and the child becomes an overall burden to the society and to the family.
Once a child is assessed by us as an ENT surgeon and our audiologist, we come to the conclusion of whether this child has a conductive hearing loss, which could be due to infections and are often reversible through medication or small surgical procedures. Alternatively, the child may have a more significant permanent or sensory neural hearing loss, and that's what we're really interested in. In these situations, depending on the degree and the nature of the hearing loss, we might look at the option of a hearing device, and that may be a hearing aid for a child with a mild or a moderate degree of hearing loss. But in those children who have a severe or a severe to profound hearing loss, who do not get the benefit from hearing aids, these children must seriously be evaluated for the option of cochlear implants, which will almost certainly give them good hearing. So the treatment of children with hearing loss requires a multidisciplinary team, and that is critical to ensure that we not only have the right diagnosis, but we can institute the right treatment options for that particular child, be it hearing aids or in cochlear implant. So as an experienced team of multidisciplinary specialists, we are able to provide the best diagnostics and the best outcomes for a child with hearing impairment.